The private health system in America could lose $200 billion this March to June as the coronavirus keeps hospitals from performing the elective surgeries and the outpatient services that make them money. NBC News correspondent Anne Thompson takes us inside a New Hampshire hospital that's trying to stay afloat.
Pandemics mark the history of St. Joseph Hospital. Opened just a decade when the 1918 flu hit. This year, it braced for COVID. COVID never overwhelmed St. Joe's, but the costs are $50 million and counting.
That's just a recipe for disaster for any hospital, not just ours.
Nationwide, hospitals and health system losses could top a staggering $202 billion from March to June.
Not since the Great Depression have doctors and hospitals and other healthcare institutions faced the kinds of disruption that they're experiencing right now.
As the virus raced up the East Coast, St. Joe's tripled its beds, scrambled for ventilators and PPE, and stopped elective surgeries, cutting off the major profit stream most hospitals depend on.
It does represent 72% of your revenue now is diminished.
That's a body blow.
That is a body blow, because we have to be safe.
So we're going to talk to your son today.
Across the country, telehealth visits are up, but other hospital services plummeting. Dermatology down 67%, gynecology 75%, ophthalmology 81%. To cut costs, more than 250 hospitals furloughed thousands of workers, including Caitlin Sassville at St. Joe's.
I was actually kind of shocked. I've been working crazy hours at first. I was upset. I cried. Operating room, it's Katie.
Now with elective surgeries to schedule, Sassville is back after 2 weeks at home, one of 6 workers recalled out of 300. Hospital's other financial hit?
We're having to spend 10 and 20 times more for the same piece of PPE.
Burning through 1,100 isolation gowns a day.
They have a pattern.
St. Joe's supply chain manager Robin Gershik is ironing together homemade gowns on her dining room table.
I can't make respirators. I can't make N95 masks. But this gown is so simple. Why can't we do that?
But it may not be enough to keep hospitals alive.
They'll cut back their services. They may no longer provide hospital or maternity care. They may just have become an emergency department or an urgent care center and a smaller hospital sector when the dust settles.
Making hospitals the next victims of the virus.
And Anne joins me now from Manchester, New Hampshire. Anne, what is the situation at St. Joseph Hospital now?
Well, they are trying to bring back all 300 of their furloughed workers, but it is a slow process, and it is a slow process, Allison, because it is taking time to ramp up those elective surgeries that those 300 workers are somehow connected to. And part of that process revolves around patient confidence. With COVID, a lot of patients decided they didn't want to go to the hospital. They were afraid to go to the hospital for fear they would catch it. So now hospitals like St. Joe are spending their time trying to educate their patients about their cleaning processes, about the procedures they'll go through, and trying to help do some triage work, if you will, through telemedicine, using your iPad or your iPhone initially to put people at ease about coming back to the hospital. Once they bring those people back, they think that profits will come back, and then those furloughed workers can come back.
And you spoke with a hospital worker in your story who was making gowns for nurses and doctors. Are smaller hospitals like this one still having trouble getting the protective equipment they need?
They are, and Robin Gershik, it really is the personification of what they call Yankee ingenuity here in New England. I mean, she did that on her dining room table. She figured out a pattern. She bought the material they use. You buy at an arts and crafts supply store, and she has given the pattern to volunteers, and now they're doing it to make sure there's enough isolation gowns. But because it is not made by a medical supply company, the CDC requires that it be a different color. So it is a white gown, so the doctors and nurses know it's not the one that would come from, for example, a manufacturer in China. But yes, they are still having trouble getting that equipment, in part because they're still seeing evidence of price gouging.
And it is amazing they are still dealing with that shortage, but incredible Yankee ingenuity, as you said. Thanks so much, Ann. Great to see you.
Take care, Allison.
Washington, D.C. was on track to start reopening this Friday. The mayor saying she needed to see 14 days of declining coronavirus cases first, but a spike on Sunday could push all of that back. NBC News political reporter Ali Vitale with me now from D.C. And Ali, where does the mayor stand now on reopening D.C.?
Allison, yesterday was supposed to be day 14. D.C. is a city that's really been trying to be a stickler for having 14 consecutive days of declining cases before it reopens. That 14th day was, as I said, supposed to be yesterday. But over the weekend, a spike in cases sort of spiked that trend, setting them back not to day 0, but to day 11. That's not math that necessarily makes sense to me, but it's where we are right now, with the mayor saying in a press conference today that she's going to ultimately decide tomorrow whether or not the city is officially going to go forward with a phase 1 of reopening on Friday, because you'll remember, while neighboring states of Virginia and Maryland have started partially reopening, D.C. is still closed, still a stay-at-home order here in the district.
Yeah, Ali, you mentioned Friday would be phase 1. What will D.C.'s reopening phases look like? What would be scheduled to come back first?
So this is a little bit up in the air because the mayor has tried not to put too much in stone here. Even the reopening day itself is going to be confirmed if it happens tomorrow once they see their new 14-day decline in cases. So what will open if they move forward with opening is pretty similar to what we've seen in other cases around this area. It means barbershops. It means restaurants with outdoor areas. It means that stores can start doing curbside and delivery, not necessarily opening their doors and letting people in, but certainly starting to do some business, at least from their storefronts, with people coming and picking up as they go. And I think the key thing here is in D.C., much as we've seen in other places across the country, reopening means that you're allowed to do it, but business owners really have been making their own decisions, figuring out what works for them, where they're comfortable, and how they're comfortable reopening. So it's a broad mandate from the government that then trickles down to the most granular of business owners so that they can make their own decisions.
Ali, one of the things we keep talking about here is testing and how a spike in cases could just mean that more testing is available. Is it possible that that's what's happening in D.C.?
That's entirely possible. I was in Maryland last week, for example. That's a state that has started reopening. And a few days after they reopened, they saw a spike in cases. When I was talking with the head of the testing facilities there, she was telling me that it's probably too soon. There's only a few days that had elapsed to tell if there was a direct causation between reopening and spiking tests. That was in Maryland, at least. You look at a place like Virginia, you look at a place like D.C., I'm sorry, the whole DMV is mushed together for me in my brain right now. But you look at a place like D.C., they're still closed and they're trying to expand testing. But it's notable because Dr. Deborah Birx pointed out that the whole DMV region is cause for concern right now because there is still a high spread of cases here in this area. That being said, D.C. has worked really hard to try to expand testing. And this is where I am today, a site that has seen hundreds of people come through by appointment, but they don't have to have symptoms, basically allowing people who are asymptomatic to figure out if they have it and what they can do with that knowledge. And the fact that knowledge is power was really important to one of the women who I met this morning. I want you to take a listen to our conversation.
And, you know, I have loved ones. I want to make sure everybody is safe. You know, for me, you know, just in case, I want to make sure everybody is safe.
Knowledge is power.
Exactly. Exactly. If they said we can open up today, we still need to take the same precautions. You know, it doesn't, 14 days, 3 days, you know, we still need to make sure everybody is safe.
Do you think, though, that it's time to reopen?
At some point, I think we need to think of everybody and, you know, you know, people that are unemployed, I know they're very anxious about going back to work, and kids want to be able to get out. But this thing has affected and taken so many people that we still have to continue to make sacrifices.
Allison, Timmy touches on something there, this anxiety that pulls in both directions, the desire for people who have been hurt by this economic downturn, for them to be able to start getting back to work, reopening their businesses, getting back to finding their jobs if they've been laid off. That comes often in contrast with this desire to reopen in a way that goes with the science, that goes with the data, that requires, frankly, patience to see cases on a declining trend. But Timmy also mentioned something else there that I think is worth reminding, especially after a weekend where we saw beaches flooded with people. And of course, everyone has seen that pool in Missouri since that happened over the weekend, with just crowds of people basically ignoring all of the guidelines that we've heard. Timmy makes the point that you need to be able to still take these precautions even after reopening happens, something that I know that officials here in D.C. have been warning about, and of course in states across the country too.
Yeah, Ellie, you mentioned earlier what's going on in Virginia, what's going on in Maryland. I know you've been covering the entire DMV. In nearby Northern Virginia, there was a record high number of cases. How is what's going on in the neighboring states, or is what's going on in the neighboring states, going to have an impact on the decision whether to open D.C.?
We'll see. I mean, really, the reality for this virus, and local and government officials have said this consistently, it doesn't respect state lines. And so it does require governors and other local officials to work together on this. There has been communication between Governor Northam of Virginia, Governor Hogan in Maryland, and, of course, local officials here in D.C. But that being said, Maryland and Virginia did speed to reopening a lot more quickly than D.C. did. Although I will point out that there were areas that were around the D.C. area, parts of Maryland, parts of Virginia, including Northern Virginia, like you mentioned, that they instead pressed pause, didn't open as soon as the rest of the state did, and instead they focused on expanding their testing capabilities so that they would have a better grasp on what was actually happening on the ground before they started reopening.
Hey, NBC News viewers, thanks for checking out our YouTube channel. Subscribe by clicking on that button down here, and click on any of the videos over here to watch the latest interviews, show highlights, and digital exclusives. Thanks for watching.